the details of the activities of Department of Cardiac Surgery. Our outpatient attendance has been steadily increasing over the last few years, and this population represents a mix of babies, neonates, and elderly patients right up to the age of 100 years. They come from all parts of the country, and they come from different countries as well. The admissions were increasing till about a couple of years ago. There has been a slight drop, and we believe this is due to the withdrawal of the government insurance scheme. And with the renewal of the Chief Minister's insurance scheme, we expect these numbers to pick up. The number of cardiac catheterization and interventional procedures have again been increasing over the last 5-6 years. A small drop again related to the cost factor because of the suspension of the insurance patients. Patients come from far and near. We have patients coming from as many as 45 to 50 countries. A large number of patients come from the Middle East, and the largest group being from Iraq. I'm sorry. Patients come from distant islands like Nauru Islands, which I had to look up in the map where Nauru is located. They come from developed countries like the United States of America and Japan. And they come for different reasons. Economic affordability is just one reason. They come for the quality of care, they come for the timely care, and they also come for the friendliness which this hospital is able to provide. Numbers is only one side of the story. Many of us who work here do so because of the quality and the excitement that goes with it. Every year we are proud to develop some new method, new technique, and we are proud to present that in our meetings. Now this is an example of what we did in 2011, and it's called hybrid palliation. Most places in the world would have surgeons and cardiologists competing with each other. Here we have a center where cardiologists and cardiac surgeons talk to each other, work in cooperation for the benefit of the patient, for better results, for easier achievement of the same result, and for better economy. Now here is an example of a newborn baby who had a severe life-threatening condition called hypoplastic left heart, and we were able to get access because of the surgical opening. We could place a stent in the narrow patent ductus arteriosus, and after opening, the patent ductus is quite widely flowing. Now this is a tremendous achievement as far as the patient is concerned. It reduces the risk, it reduces the cost and the hospital stay. This is just one example of teamwork at Frontier Lifeline. We have several other examples. In the last 1 year, we have done 3 patients with transcarotid stenting of the ductus, again in newborn patients. Many patients who need reoperation and enlargement of the branch pulmonary arteries, we stent means that we enlarge the pulmonary arteries and keep it open by metallic stents. And we also do stenting of the ductus along with PA banding in hypoplastic left heart. We keep exploring the frontiers of medical treatment, and one of them is stem cells. Stem cells is not new, many centers are doing it. We are one of the earliest centers to start doing it in a variety of indications, the chief one being a dilated heart with weak muscle. We have done nearly 75 patients for stem cell for different reasons, for failing heart, for peripheral vascular disease, for unexplained pulmonary arterial hypertension. Now, the results are still to be analyzed as part of an ICMR trial which was registered in the year 2010. But just to give you one example of a patient who wrote back to us out of gratefulness, and he writes, I quote his words, "I was a very sick man with a continually worsening heart condition. My heart function was at a low of 25%. And afterwards, within a short period, I could feel a dramatic improvement in my health and continue to get better." We will analyze objectively whether he has really improved, whether the other patients have really improved, and present it in the scientific forum. But This sort of feedback gives us encouragement to go forward. We have been enhancing our services in this center and in our sister centers and other places, and a new state-of-the-art cath lab with stent boosting technology is functioning from December in Parimala in Kerala. It's one of the first rural cardiac, tertiary level cardiac center in a setting of a village. While being a corporate center catering to numbers and patients from India and abroad, we have not forgotten the importance of teaching and education. We have a regular academic calendar, and in the cardiology department, we have a training program almost every quarter in the year. We started year 2011 with the first electrophysiologist meet. This was followed in February with the 6th postgraduate update in clinical cardiology. I'll talk about it a little later. And this was followed up in July with a training with basics in echocardiography. These 3 meetings are an example of the different levels of teaching. The electrophysiology fellows are an advanced postdoctoral level. The update is for students going up for their examination in cardiology. And the last one is for basic doctors who want to get a initial feel of echocardiography, or even technicians who want to get into the field of echocardiography. So we cater to paramedical, students in medicine, and postgraduate doctors. The postgraduate update in clinical cardiology has been consecutively going on for the last 7 years, and 2011 was the 6th such program. We draw upon a very eminent faculty from all over India. They are very, very dedicated teachers who at the age of Dr. Tandon, for example, is beyond 80. He's willing to come every year to teach our students and students who come from all over India. The last update in 2011 registered more than 160 students. The special feature of this update is live cases demonstration and interactive sessions. The basic echocardiography course has also been being regularly held for the last 7 years. The important thing is that besides didactic lectures and discussion, we give them hands-on training on an echo machine with live patients and volunteers. It's been said that once you register for medicine, you'll keep learning all your life. So our faculty are not short of learning opportunities. They take every chance to learn in India and abroad. And Dr. Sashireka, our staff cardiologist, went to USA Boston for advanced training in echocardiography in May 2011. Dr. Shanti and Dr. Anuradha, our pediatric cardiologists, took pains to go and qualify for the certificate course in the palliative care. And Dr. Madhu qualified for being a fellow of the American College of Chest Physicians. We provide training to people who want to become cardiologists, pediatric cardiologists, anesthetists in cardiology, and even community cardiologists. And we offer a variety of degrees under the auspices of the National Board of Examinations, under the IGNOU University, and under our own banner, the fellowship. More recently, we have been recognized by Dr. MGR Medical University in Chennai for the fellowship course. And we congratulate all our postgraduate students who are qualified in the year 2011. Dr. Anand, Dr. Sudeep, Dr. Vaishnavi, Shanmugavadivu, Jyoti, Balaji, Uday, and Binil Kumar. We always welcome talent, knowledge, and experience from outside. And 2 senior consultants, Dr. Pramod Jaiswal, he's no stranger to us. He's been with us earlier. He has rejoined our fold and strengthened our department. And Dr. Narayan Swami, who comes with a long experience from the railway hospital, has also strengthened the Department of Cardiology. Postgraduate students who have joined for learning and training further are the DNB students shown on the left and the PGDC students shown on the bottom. We celebrated a number of days in 2011. The most important one was World Heart Day on September 24th. We took this opportunity to launch new services. Dr. Shanti was instrumental in initiating the palliative cardiac care, and we launched the palliative cardiac care for care of patients who are terminally ill, who would benefit from supportive services and supportive medical services. We also have an understanding with the 3 cities special economic zone and running a trauma center, and we inaugurated the accident and emergency ambulance service on that day. Many other World Days were celebrated in 2011. They were not merely days for celebration and partying. We took the opportunity to dedicate ourselves once again to the care of our patients and to offer them new services. For example, on the World Asthma Day and the World COP Day, Dr. Madhu and his colleagues organized a lung camp and free lung function tests and advice. We have been instrumental in holding Nurses Day year after year, and besides the traditional oath, we have been increasing our services to our patients. We have not forgotten our social commitment to the poor patient, to the socially downtrodden and who are not so economically privileged. And we are proud of our red and blue bus which travels all over the state and outside the state to conduct camps. It's fully equipped with cardiology investigatory facilities. We conducted camps in Kodaikanal, in several areas in Chennai itself and other parts of Tamil Nadu. Over the last several years, the number of patients seen in the camps have been increasing, and we are a total of more than 50,000 patients over the last several years. So that brings to the end of my talk, and from the ever-growing Frontier Lifeline family, I say thank you for your attention.
Thank you, sir. I now request Dr. Ravi Agarwal, cardiac surgeon, to deliver the highlights.
Good evening, all present on the dais, my dear colleagues and friends. Last year, when I concluded my talk about the highlights of this hospital, I had concluded it with this quote: to accomplish great things, we must not only act but also dream, not only plan but also believe. And today, after 1 year, when we stand here, I think we can all see what can be accomplished by dreaming big, and not only by dreaming, by believing that you can do it. And I think I must congratulate our chairman for doing what he believed. Now it is my privilege to present the highlights from the Department of Cardiac Surgery. And during the last year in 2011, we have done a total number of 1,122 cases and a good number of adult and pediatric mix, around 680 adult cases and 430 pediatric cases. Apart from this, we did a total of, we have done total number of 35 cardiac transplants till now, out of which 4 were done last year. But one of the unique features of the transplant done last year, that for the first time in the country, a patient was bridged to transplant using a ventricular assist device. And for first time, we used in our country this Levitronics Centrimag ventricular assist device, which is a special type of device which is based on the principle of magnetic levitation. And the motor, it rotates in an environment which is free of any friction, and that's why there is no heat generation. This ventricular assist device was used in a lady who was 46-year-old, and he had got a very short history of heart failure because of viral myocarditis. She had already undergone stem cell treatment which had not helped her at all, and she was having repeated arrhythmias, and there was no other option. While we were waiting for transplantation, she was so sick that we had to put her on the ventricular assist device. And I hope you can see this video. Anyway, it doesn't seem to work. But the important part was that we could put this lady for 47 days on a ventricular assist device while we were waiting for a heart, suitable heart to be transplanted. And I must congratulate our team in the ICU and our perfusion department for their meticulous planning and the way they took care of this patient. That 47 days this patient had no infection and she was in a good shape, and we could bridge her successfully to the cardiac transplantation. Another significant event which occurred last year, that we did the first time a off-pump transapical transcatheter aortic valve replacement. This workshop was conducted in 2010 April, and this paper we got published in the Indian Journal of Thoracic and Cardiovascular Surgery. And we were very happy to see this patient come to us in October 2011 after 18 months of follow-up. This patient was so sick at the time of surgery, but when he came for follow-up, he was asymptomatic, his left ventricular function had improved, and there was no valve regurgitation and very low gradient across the valve. And now we can say for sure that this type of treatment will soon be available in our country after the DCGI approval of the valve. And we will be able to help many patients who need aortic valve replacement but are not in a good condition to undergo the procedure. So these were the two significant events, surgical events, which took place last year during our practice. We are also very fortunate to welcome new colleagues in our department. Dr. Christopher Roy joined us as consultant in the Department of Cardiac Surgery and Medical Superintendent. Dr. Gilbert and Dr. Sanjay Cherian also joined us as consultants in the Department of Cardiac Surgery, and Dr. Vasudevan as a consultant in the Department of Cardiac Anesthesiology. We had a number of foreign trainees who came to us for a short period of time for training, and among them were Dr. Ayabala from Istanbul University, Turkey, and recently she wrote back to me that now she has become a consultant in her department after passing her board. Dr. Jalal came from Geneva University in Switzerland, Dr. Haim came from Iraq, and Dr. Bashir Ahmed from the Penang General Hospital from Malaysia. Last year we added 2 more units to our existing number of hospitals under the Frontier Lifeline fold. We inaugurated the cardiovascular and thoracic surgery unit at the Pushpagiri Medical College in Tiruvalla, and now we are running it as a full-fledged department of cardiovascular surgery with a cath lab and 2 operating rooms. And we inaugurated another accident and trauma station at Sri City Special Economic Zone, which is very close to this place, and we are running a full-fledged accident and trauma center there. During this last year, many of the faculty from our institution, they were invited for various lectures abroad and in the country. Dr. Cherian went to Germany to deliver a lecture on the Chennai experience in unifocalization, and then he went to Iran for the Razavi International Cardiovascular Congress, where he presented his paper on coronary endarterectomy. Dr. Sanjay Cherian also presented a paper during the same meeting, and I went to the Global Forum meeting in Geneva, where I talked about the tetralogy of fellow from our database, which we are collaborating with the Boston Children's Hospital, that is known as the International Quality Collaborative, and we shared our experience with the tetralogy of fellow. I like to especially mention the awards which were won by our perfusionist, Ms. Lavanya, and during the last year she won 2 Best Paper Awards during the annual meeting of perfusionists in Kolkata.